can mental health conditions be detected and aided by artificial intelligence? By Shambhavi Kumaran from Woodson High School.
And Areen Hashemi from Herndon High School.
Hey everyone, I'm Shambhavi, a rising senior from Fairfax, Virginia, and I am so thankful to be able to participate in the conference this year. A few activities I'm involved with include Amnesty, Operation Smile, HOSA, and being a student researcher at DCVAMC as well as Amrita for the past 2 years. Around the time of the global pandemic in 2020, I became interested in the topic of mental health and learned more about the causes and effects due to my own experiences. Last year, I brought forward an idea to create a mental health related app to my team at Amrita. The project is still in development, however, it has been acknowledged and presented at the IIT Global Conference and many others. In the future, I hope to pursue a career in anesthesiology or cardiology.
Hi everyone, my name is Areen and I'm a rising senior from Reston, Virginia. Honored to be a participant here at the GHLC this year. A little bit about me is that I have OCD, and my personal experiences with mental health led me to creating Normalizing the Conversation, an online mental health advocacy community of over 24,000 wonderful people. Additionally, I helped found Generation Union, which is a nonprofit that focuses on uplifting elderly mental health and wellness. In the future, I hope to pursue a career as a social entrepreneur, continuing to scale my work and impact in the mental health advocacy space. In this presentation, we will first be discussing the urgency of mental health as a global health crisis, and then discuss how artificial intelligence can assist in alleviating this crisis. Mental health is a global health issue, with over 970 million people, that's 1 in 8, living with mental health conditions that affect their daily lives, careers, and relationships. Despite this large number, the World Health Organization still states that mental health is a silent disease, with many conditions often going undiagnosed or even misdiagnosed. Additionally, even when diagnosed, mental health warriors often cannot or do not receive the right type of treatment due to 1. The widespread mental health stigma that dismisses or downplays serious conditions, as well as 2. The inaccessibility of expensive mental health care. The consequences of not receiving diagnosis or treatment are devastating. According to the National Alliance on Mental Illness, 46% of people who die by suicide globally had a mental health condition that could have been addressed. In other words, 46% of suicides could have been prevented with the right measures.
However, with artificial intelligence, we can streamline the process of identifying mental health conditions by aiding healthcare professionals in diagnosing and addressing these conditions more efficiently. As AI continues to evolve and transform our daily lives through its expansion into the internet and workforce, its potential in the public health field is equally promising. In another project I have done through Amrita in collaboration with Mary Washington Hospital, I focused on integrating artificial intelligence in the administration department to improve patient satisfaction and quality of care. Similarly, advanced AI can analyze inputs to detect signs of mental health issues by utilizing a machine learning system trained on historical data and refined to minimize false positives and negatives. The graph above shows the precision recall curve, which is a visual of the trade-off between precision and recall for different threshold settings that have been adjusted. Precision is the value of true positives plus false positives over true positives, and recall represents the value of true positives plus false negatives over true positives. In the graph, closer to the y-axis, the high precision and low recall values represent the most positive feedback points, but also have many false positives. The other end of the graph, closer to the x-axis, shows low precision and high recall that has a lower chance of false positives, but also misses many positives. We have been able to find the threshold value that works best for our app and can give the user the correct feedback based on their inputs into the app. AI can assess factors such as grade, age, gender, family history, and race to identify early stages of conditions such as anxiety and depression. As shown in the chart above, Once the data is passed through the machine learning training models, it will be able to send out alerts or any required feedback to the users. Upon detection, users could gain help, and parents, counselors, or healthcare professionals could also be alerted, potentially altering lives globally. By working with school administrators and parents, we can implement the app in schools to have a greater impact on a multitude of people, and the technology will adhere to data privacy laws, including FERPA and HIPAA. In the future, working with my team at Amrita, we aim to further enhance the technology and eventually expand the app to offer potential solutions or treatment options, such as ways to reduce stress or anxiety built into the app.
Across the world, the 970 million mental health warriors can benefit with the use of the app as a more accessible form of identifying mental health conditions. By no means is AI a replacement for professional diagnosis and or a replacement for professional treatment, but rather an assistance that can make a small but impactful step towards improving a person's life.
Artificial intelligence can significantly enhance the identification and management of mental health conditions by simplifying the diagnostic process and providing timely interventions. Through projects similar to the app, AI can analyze various factors to detect early signs of mental disorders and alert relevant parties, which could potentially transform lives on a global scale.
Mental health is a journey, not a destination.
AI can help with that journey.
These are our citations for sources used in this presentation. And before we conclude this presentation, we would love to thank the GHLC board for giving us a platform to share our approach for bettering mental health,
The Amrita research team, including IPSA, Arjun, and Vishwa, for assisting me through this project,
as well as the audience for their time and attention. If you have any questions, please don't hesitate to reach out to us through email or LinkedIn.
Thank you. Have a great day.